The title of this presentation is Difficulties in Getting Prescription Drugs Filled in the United States. Good drugs extend life. The death rate from heart disease has decreased by 2/3 since the 1970s. Cancer survivors have doubled over the past 25 years, and 2/3 of those diagnosed with cancer can expect to live at least another 5 years. But bad drugs shorten lives. Opiates kill more than 50,000 Americans a year, 10,000 more than AIDS did at its peak, more too than gun homicides and motor vehicle accidents. Opiate overdoses are now the leading cause of death for Americans under the age of 50. Americans are dying younger than people in other rich nations. We spend thousands of dollars more per capita on health care than any other country in the world, but in return we live shorter lives than most people in most other rich nations. Patients often don't get the prescription drugs they need. Why? Lack of funds. 78% of patients are living paycheck to paycheck. Financial stress and illness are in lockstep and feed on one another. Insurance does not cover prescribed drugs. And non-adherence. 1 in 5 patients are not filling prescriptions, and up to 50% of medications are not taken. Money is the big hurdle. Nearly 1 in 10 American adults go without prescribed medications because they can't afford them, according to the U.S. Centers for Disease Control. 1 in 2 patients with health insurance face a $1,000 deductible before their insurance kicks in. This means that many Americans still can't afford to get medical treatment before a condition becomes urgent. Even with employer-provided health insurance, out-of-pocket spending has increased by more than 50% since 2010. Legal drugs can run a person over $300 for a 30-day supply. Orphan drugs, which include personalized medicines, now constitute about 40% of all new drug approvals and will soon be a majority. They cost patients, on average, $83,000 per patient per year. American spending for prescription drugs is expected to surpass $1.3 trillion in 2018. This number is larger than the gross domestic product of 15 countries combined. As the cost of prescription drugs continues to rise, so does the share of their costs patients pay. Deductibles, for example, have on average increased 2.5 times over the past decade. Prescription drugs account for 1 out of every $10 spent on health care in the U.S. and is climbing. Why people don't get their prescriptions? A drug is not on the formulary. The generic doesn't work and the brand name drug is either not on the formulary or too expensive. Patients can't afford the newest, most expensive drugs. Between 2011 and 2015, the Pharma Big Ten, the nation's 10 largest drug companies, jacked up the prices charged to consumers, Medicare and Medicaid, for 31 of their most widely prescribed drugs by an average of 40 to 70%. Law enforcement has made doctors reluctant to prescribe pain medications. Doctors refer patients to pain doctors who as a whole work to get patients off pain medications. Here's a quote. "Time and again we get calls from people where their physician has refused to prescribe any more opiates," according to the executive director of the American Chronic Pain Association. Some people become addicted to drugs like painkillers as people become addicted to heroin. When patients can't afford to get the drugs legally, they turn to the street where they are cheaper, order from outside the U.S., or get them from a friend, neighbor, or elsewhere. These may be the wrong drugs or contaminated. Combining drugs has risks. Mixing anti-anxiety medicines and other drugs or using the wrong drugs can slow breathing and brain activity, causing difficulty breathing, coma, or even death. Not getting or taking the wrong drugs escalates a problem into a crisis, and 1 out of every 6 emergency room visits in the U.S. is drug-related. Why people become addicted. When people feel disconnected from society, lonely, insecure, they turn to drugs, alcohol, or food to relieve mental anguish. For example, since 1960, obesity has risen in American men from 10% to 40%, and in women from 15% to 40%. Alcoholism soared in the 18th century when Britons in mass numbers left the rural area for cities. Drug use was the norm in Nazi Germany and helped fuel the Nazis' frenetic rise to power. From Hitler's heroin-laced drug cocktail, the military's ingestion of a form of crystal meth, and the general public's regular use of Pervitin. In the United States, the rise in deaths from despair, committing suicide, abuse of drugs and alcohol has shot up since the late 1990s among middle-aged white Americans. Marketing and addiction. America's opiate epidemic began at the pharmacy. Beginning in the late 90s, Big Pharma began marketing opiates like Percocet and Oxycontin, resulting in 1 in 130 people becoming addicted to them. More than half of all people with disorders such as depression, anxiety, or alcohol abuse who died from an overdose between 2001 and 2007 were chronic pain sufferers who filled an opiate prescription and sometimes even saw a doctor in the month before they died. Only 4% of these addicted people were ever diagnosed as having an abuse problem. 92,000 newborn babies to teens who inherited addictions from their mothers were placed in foster care away from their parents, incapacitated by drug use in the past year. 2.1 million Americans are addicted to opiates. Nearly 1 in 2 Americans, 46%, have a loved one or friend who has struggled with drug addiction. Every day, 100 Americans die of overdosing. Since 1999, deaths from opiates have quadrupled. More than 42,000 Americans died of opiate overdoses alone in 2016, a 28% increase over 2015. American life expectancy at birth declined for the second consecutive year in 2016, fueled by the staggering rise in the death from drug overdoses, according to the Centers for Disease Control and Prevention. This chart shows the progression of substance abuse deaths and identifies particular drugs such as heroin and prescription opiates. Deaths in Kentucky, West Virginia, Ohio, Indiana, and Missouri have skyrocketed. But opiate addiction is not being treated adequately. Over 10% of people with substance abuse disorders receive treatment, the goal of which is to eliminate the craving. However, opiate addiction is solvable. 1 in 5 GIs self-identified themselves as heroin addicts in Vietnam. When they were treated in Vietnam, 95% of them did not become re-addicted when they returned to the United States. But when addicts were treated in the U.S., relapse rates hovered around 90%. The key to these dramatically different results was being treated in Vietnam, where they became addicts to the very different environment of the United States to which they returned. The Swiss had a major addiction problem until they admitted all addicts to clinics, removing them from the street, the environment where they had become addicted. In the clinics, they were given opiates under the supervision of a nurse. After a few years, virtually everyone leaves the Swiss program cured. 7 in 10 Swiss voted to keep the clinics, and drug dependence in Switzerland is decreasing. Here are some tips to find prescription drugs at the best prices. Sites like GoodRx.com and HelpRx.info show price comparisons of tens of thousands of drugs. Though decreasing in availability, some drug companies have drug assistance programs available which can be applied for. Go to freedrugcard.us to learn more. What reforms are needed? Regulators need to curtail drug makers' practices of delaying the availability of generic and biosimilar drugs. use of the federal government's purchasing power to directly negotiate lower prices for patients on government programs such as Medicare will lower drug costs. More required public reporting by drug makers, insurers, and others of how medicines are priced. New efforts to determine the value of drugs by assessing how well they work relative to how much they cost. And less direct-to-consumer advertising by drug makers. What every American deserves. People need to be assured they can afford and have access to the medicines they need, but the new tax bill will make this less possible and, in fact, make medicine less available. This video is part of a series entitled Healthcare for All. Other videos in this series include From Chuckholes to Sinkholes, Hurtful Gaps in Americans' Health, Healthcare for All, The Problems of Aging in America, What Effect Does Healthcare Have on Our Economy? My name is Paul Edwards. My website is localmarketing.center and email homeplus99@gmail.com. My phone number is 661-242-2624. In closing, keep in mind that to reach consumers and voters, we must work smarter than in past years. I hope these ideas enable you to talk with consumers and voters more effectively.